Hey everyone, it's Dr. Ellie and I'm here with my podcast today, I Heal Kids. And if you don't know me, I'm a holistic pediatrician in Asheville, North Carolina, and I take care of kiddos 0 to age 21 for holistic pediatrics. And I also do some functional medicine for kids ages 2 to 102. So if you don't know what functional medicine is, definitely check out my other podcasts and we'll link them in the show notes. Well, today I am super excited. We just finished our 4-part mini-series all about poop. So if you guys are interested in that, go check those out. And that sort of prompted me to make this other series, which is about spitting up. Because I mean, honestly, you've got one thing coming out of one end. So naturally, my mind went to the other end. And also, it's a super common baby problem and a lot of people worry about it. And I just want to make sure that you guys know like what's normal, what's problematic, when to worry and when not to worry. So when it's like 2 a.m, you're not just like frantic or running to the ER unnecessarily, or like on the other hand, you are going to the ER if you need to. So we're going to talk about, normal versus not normal. And is it just spit up or is it something a little bit worse? Let's just start with actually the physiology. Okay. I know that's like a big medical word or whatever, but basically like what's happening, like why is spitting up even happening? What is normal baby spit up? What is going on with their gut? Like, why do babies even have this problem? Like as adults, we're not like walking around just like vomiting our lunch continuously. So like, it's kind of weird if you think about it, that babies just like will spit up. So, okay. So what is going on? Babies we all have this thing called our lower esophageal sphincter. Sphincter just reminds me of what was that, like Wayne's World or something? I don't know where it was from, like some 80s movie. Anyway, essentially, it's just a band of tissue that wraps around like the lower part of the stomach, the intestine area where that connects, like the intestine and the stomach connect. It helps sort of regulate flow, if you will, from like the stomach to the intestine. And babies, theirs like isn't really mature yet. So it's not functioning very well or very correctly. So you combine that with an all liquid diet because, what are babies eating? They're eating breast milk or formula, or they should be, one of the two. Don't feed your baby Gatorade or anything. That is not good. Or water. But yeah, so you've got an all liquid diet, plus you're feeding them frequently, right? So they're eating often, they're eating all liquids, they've got a valve that doesn't work appropriately. And next thing you know, the food is just coming right back up. As a pediatrician, like we often refer to this as like the happy spitter. So it's like the baby that's like giggly, gaining weight, acting totally normal, having good wet diapers, super like not really bothered other than during the actual spit up, they might be a little bit like, oh, like what's going on? I mean, they're not looking like overly distressed, but no one feels great when like food is coming out of their mouth. But in general, the babies are pretty content. They're not super bugged. They're still feeding regularly. They're not like fussy with feeds. They're just spitting up. But when you go into the pediatrician, they're like, yeah, your baby's gaining weight really well. They look great. They're developing well. Don't stress about it. So I have cared for like hundreds of babies that spit up because almost all babies will do this. It's about 40 to 50% of all babies will spit up, and it's totally normal under those circumstances that I just stated. And it's more of just like a washing machine laundry issue and like a lot of stress that way, but not a medical concern. I want to mention just super briefly like poop and stuff like that. I don't want to get into it a whole ton here because we talked about it in that 4-part mini series. But that's also a good sign of like gut health if you know like the good colors of poop. So if you haven't listened to all of that about poop, go back and listen to that too. On that also, breastfed babies sometimes will spit up less than other babies. And also sometimes they'll have different poop patterns. So just go check that out. When is spit up a problem? What are the red flags? This is like, go do something, call your pediatrician. Go to the ER, go to the urgent care. So these are the things you really want to watch for. and be concerned about. So if your baby is not gaining weight well, and hopefully that should be something that your pediatrician is monitoring, but if you have a baby scale at home or something like that, I mean, don't weigh them every 10 minutes because obviously their weight will be different whether they pooped or not, or like vomited or not, or spit up or not, depending on like what is the situation. But if in general they're not gaining weight as they should, which in the early days is like at least an ounce a day, if not a little bit more, but around that ounce a day mark, then they should be evaluated. Okay, so if you are concerned like your baby's maybe not gaining weight as they should be, then definitely call up your pediatrician and make an appointment. Okay, because sometimes like scales can be weird, and sometimes, I don't know, something weird happens, like you forgot to tear the scale and you don't want to like unnecessarily rush to the ER and then like find out their weight like actually was fine. So, that might be one just to notice and then go to the pediatrician. Okay, blood in the spit up or the poop. I think most people would find that alarming and like take some action, but just as a reminder, if you are seeing blood in the poop or stool, you definitely just want to find out like what is going on. In babies, luckily it is rarely like a serious disease when you see it in the stool. A lot of times in the poop, it can be like a milk protein intolerance where we have to like take dairy out of mom's diet, or it can be like an issue with like an anal fissure. Like let's say they had a little constipation and they had like a hard poop come out, that can cause it. If you're seeing blood in the spit up, that can certainly be an issue. On occasion, it's just like some kind of irritation. So like I see this sometimes with a baby that has like a lot of coughs or colds. They've been coughing a lot. Maybe just like a little teeny little kind of fleck will come up. Usually that's not a huge concern, but you do want to at least check in with someone and make sure, because obviously if there's a lot of blood in the spit up, it can indicate something more serious in the stomach, in the intestine, and all of that. Okay, feeding refusal. If your baby does not want to eat, that is not normal. So if you are like, oh my gosh, every time I try to like latch my baby or feed them a bottle or whatever, they're pushing it away, they're moving their head out of the way, they just don't want to eat, that is cause for concern, because it could be basically they're having discomfort or pain in their esophagus or stomach. And sometimes they'll even get like what's called Sandifer syndrome, which is when the babies like arch their backs and they're like trying to kind of get away from this like heartburn feeling in their chest. That's not a good thing, because we want babies obviously to eat so they can grow. And then obviously we want them to have good urine output too. So like lots of wet diapers, because we don't want them to get dehydrated. So if your baby's not eating well, it could be pain. And so we just want to make sure that you do check in with your pediatrician about that, and also do it more urgently than not, because we don't want them to get dehydrated. On that, if you are seeing your baby that's like lethargic, having less than 2 soaked diapers in 24 hours, or looks really sick to you, please go to urgent care or ER. Irritability during the feed. Now, some babies just kind of like have a little bit of a moment where they're overtired or they're over fuzzy. It takes them a little minute to like get settled on the breast or the bottle. That's okay. But if the whole time your baby is just like not happy, super fussy, not content feeding, that also could be pain in the esophagus, stomach, something like that. And you just want to bring that up with your pediatrician to see, what you guys can do about it. Respiratory symptoms. Okay. So what we worry about with this, you guys, is that the baby how do I want to say this? So like while spitting up, that the baby is possibly breathing in down the wrong tube. So like it's called aspiration, but it's like when you breathe in down the wrong tube. So like if you've ever breathed in like pool water down your windpipe and not that you're trying to like swallow feed on pool water, but like that sensation of like having pool water go down your windpipe and you can't breathe. That's what we worry about in babies that have respiratory symptoms and they're spitting up, that they could actually be inhaling or aspirating their formula or breast milk. And that's not a good thing. You'll see things like cough, wheezing, or God forbid, stopping breathing due to this. And you definitely want to seek help for that, because it can cause really bad problems where you can get like a pneumonia in the lungs because the formula or breast milk has gone into the lungs instead of the stomach. So cough, wheeze, not like stopping breathing, all of that, like definitely seek care. And God forbid they stop breathing, please call 911. Okay, so they're turning blue, it's lasting more than 10 seconds, all of that. You see them choking, please call somebody for help. And just a plug for doing your infant CPR, okay? So if y'all haven't done that, get on that ASAP. All right, what else to worry about? Forceful or projectile vomiting. Okay, so I have been pediatrician for a minute, AKA, what is it, 18 years in August, I think. And I will tell you, it is hard to know if your kiddo is having projectile vomiting, especially if it's your first kid. And oftentimes it can really feel like that. So I just want to make sure that we kind of have a good picture of what forceful is and what it isn't. So happy spitters, a lot will come out. So do the experiment. Take like an ounce of breast milk or formula, whatever you've got, hopefully formula, or if you don't want to waste your breast milk, just do it with water. Pour it out on the countertop because you're going to be shocked at how much like 1 to 2 ounces can look like. It looks like so much. It can look like the full feed. Like if you have an older baby that's eating like 4 to 6 ounces, the 2 ounces can look like everything came up. So make sure you are checking and to see how much is actually coming up. So that's one thing. So it might just be a half ounce or something like that, but you're thinking it's like the full feed. So check that. The second thing is if the happy spitters, like if you have a baby that's a happy spitter, if they spit up, it's going to look like it's just kind of bubbling up and out of their mouth and down their shirt and down your shirt and kind of like, I don't know, like a fountain, but not like an outward fountain, like a downward fountain, if that makes any sense. Okay. And it can be from anywhere from a dribble to just like feeling like a full ounce or two came out of their mouth all at once. Okay. Projectile vomiting looks a little different. It's like more forceful. I always say, does it look like poltergeist? And that will usually, if you've ever seen that movie, like the vomit hitting the wall, it's not quite that bad. But if you feel like it could be along those lines a little bit more than just coming out and down, let someone know because this can be a concern for something called pyloric stenosis. So you may remember from earlier, we were talking about that lower esophageal sphincter, which is that little band of tissue that wraps inside the or around, or I don't know how I want to describe it, but wraps in the intestine next to the stomach. So we got stomach in the middle, we got this little sphincter at the bottom. At the top, we have another one, and it's called the pylorus. Okay, so that sometimes can get closed off, so like squished, narrowed. So it's narrowing of the stomach outlet. And that's not a good thing, you guys. So if you're seeing forceful projectile vomiting and you're worried it could be pyloric stenosis where this valve above the stomach or at the top of the stomach is narrow, you do need to let your pediatrician know right away. Or if you're seeing a lot of forceful projectile vomiting one after another, you do need to go ahead and go to urgent care ER. The reason is this needs urgent evaluation. And that's because kids can get really dehydrated really fast. They can get a lot of electrolyte imbalances really fast. And so your pediatrician or ER doctor or urgent care doctor will need to do electrolytes, and they're going to need to probably do they are going to need to do an ultrasound. Okay. So, when you're pregnant, you get that little ultrasound of your belly, same thing, to look to see if it is really narrow, because in some cases it does require surgical correction. And you want to know if your child needs that. Okay. Other things to like warrant maybe like some concerns or things to bring up to your pediatrician. Severe eczema. Sometimes there can be some stuff with like food sensitivities and things like that. So bring that up to your holistic pediatrician. I don't know. It's kind of hit or miss in the conventional world on what people think about that. And then the other thing I would say to think about is if you're also seeing like other symptoms, so like diarrhea and things like that, then you need to bring that up as well. So if you're getting spitting up and something else is going on as well, let someone know, because if you've got diarrhea, maybe it could be a virus or it could be a bacteria or some other illness. Okay. I was thinking about earlier, I actually had a baby that I saw for pyloric stenosis. And I just want to give a plug to like moms and dads, your babies. And I know, I know that when you first have a baby, it is really hard because you almost don't know what you don't know. That said, or it can feel like that. That said, moms and dads have pretty good intuition. I will never ignore that. I think there's some people that maybe like some providers maybe that like poo-poo that or like would just be like, no, you're wrong, whatever. I always follow mom and dad's intuition. So if you have the sense that your baby has something wrong and it's more than spitting up, just be clear with your pediatrician. Just say, you know what? Like I was listening to Dr. Ellie's podcast. I think this could be pyloric stenosis. I'm really worried. I would feel better if you did the ultrasound. And usually most people are pretty reasonable with that and we'll go ahead and get that done. If you get blown off, definitely go somewhere else. So no reason to live in fear. Just keep asking. I mean, I definitely have seen a kid before where parents were just like, this is not normal. And honestly, that's the best. If anyone tells me something like that and they're like, this is not normal, and I did that ultrasound, that baby had pyloric stenosis. So you will have most likely a gut feeling that something is really off. But if you're not sure, just ask and then, just mention some of the symptoms and your pediatrician should be able to help you. Super briefly, I don't want to get too much into this because we'll probably cover like things in different episodes, but colic, reflux, allergies, sometimes there can be some overlap between these things. So I talked about how colic and reflux and allergies can be interrelated. But one point that I did want to make was that in medicine, sometimes doctors will say reflux, and there is a difference between reflux and reflux disease. Okay. And I think that's confusing for people. So I just want to like tease that apart. So reflux in the medical world, that can just mean a happy spitter. Okay, they have reflux. There's refluxing. The contents of their stomach are coming up and they're happy and they're fine. Reflux disease, because now in medicine we have to put the word disease on everything, which sounds terrible. But that means something more is going on, like your baby's having pain, they're uncomfortable, they're not happy, they're irritable, they're not feeding well, and all of that. So I just want to tease that out in case you hear those two terms and you find it a little bit confusing. Also, there can be overlap with allergies and colic and things like that. So you do want to just make sure you talk to your pediatrician about it because the diagnosis can sometimes be a little bit tricky. All right. I want to talk a little bit about what should or should not happen at the doctor when you don't have red flags. So I just want to emphasize in the case that your baby does not have any of these red flags, like in the case of the happy spitter, that they are able to gain weight and be happy and just spit up and that's the end of it. Really, no tests are needed. Okay. And this is what in medicine we call like the quote unquote clinical diagnosis. And that is based on symptoms. So you come in, we look at your baby, we're like, yes, your baby is looking really healthy. No concerns there. We've listened to their heart and their lungs and their tummy, and we've weighed them and checked all of the things that we need to check. And we're like, yes, they seem healthy. You're not telling us anything. You haven't told me anything that makes me worried. Then I will most likely say your baby is a happy spitter. Go home. Let me know if something changes, and then we'll look further. And that is what's called a clinical diagnosis. So you don't need any tests, which is kind of good because who wants to do tests on a baby? That is not fun for anyone. Now, that said, if your baby does have any of these warning signs, like forceful vomiting, projectile vomiting, they're losing weight, blood, all of that, then sometimes in those cases, we need to do more tests. So for example, with the case of projectile vomiting, like I said earlier, a lot of times we're going to need to do an ultrasound. And that's just to look at a picture of that pylorus or that little valve that sits at the top of the stomach to make sure everything's okay and that we don't need to do a surgical correction and that your baby's not getting dehydrated or electrolyte imbalances. We need to do blood tests. Okay. And then an upper GI endoscopy, that would be like if your baby's having bleeding or some other symptom that we need to look with a camera and make sure that everything is okay. And I'm going to cover that more deeply in episode 2, but I just wanted to briefly touch on it. So going forward, one thing I would just suggest is like, if you think, okay, I'm pretty sure my baby's like happy spitter. I'm going to be seeing the pediatrician in a couple of days. I'm not super worried where I need to get in right away. What would I suggest? I would suggest just track your baby's symptoms. Like, are they having pain with feet? Are they arching their back? Are they feeding regularly? Do they seem like they're growing? Are they having good wet diapers? Are they having good poopy diapers? And just make sure you're monitoring if you are seeing any of those warning signs or anything that looks alarming. Just make sure you are bringing that up with somebody, hopefully at that pediatric appointment. If you need to get in sooner, obviously go and do that. Quick reassurance. So if you have kind of determined, yes, my baby is a happy spitter, It is really, really common, usually resolved by 12 to 18 months. I would say most babies in my practice by 9 months are kind of getting over the hump. But do watch out for the red flags. And then we'll talk about all the detailed management as far as like natural. Thanks to all the naturopathic doctors out there that I've been talking to lately. Anyway, natural medicines, natural non-medicines that you can do to help babies that are spitters, what we need to do if we do need to do any kind of pharmaceutical intervention, tests, treatment options, and all of that. So we're going to talk about that in the next one. And I hope that was helpful. And hopefully your babies are just all happy spitters. And we will talk soon. And if you don't know me, I'm Dr. Ellie with Middle Path Integrated Pediatrics. I take care of kids 0 to 21. And I also do functional medicine for kiddos 2 to 102. So reach on out. Okay, bye.